Good morning, and we thank everyone for attending this morning. Get rid of that for a minute. My name is Mayor Jerome A, and I bring you our COVID-19 update for May 1st, 2020. Today I'm joined by a couple of members from our community. One is the emergency manager for Gary Community School Corporation, Dr. Paige McNulty. Thank you for being here, Paige. As well as Dr. Julian Marsh from the Gary Housing Authority. In fact, he's the executive director for GHA, and thank you for being here also, Julian. As you know, today is the final day of Governor Eric Holcomb's stay-at-home order. We also anticipate that he will, at some point today, loosen the restrictions that have been in place for at least the last 40 days by way of his executive order. If that happens, we can absolutely expect an increase in people who want to visit and find opportunities for whatever things they need to do throughout their lives right here in the city of Gary. And in considering that, it's important to note that the executive order or the governor's loosening of restriction applies to Indiana specifically. Having said that, the governor has also made it abundantly clear that any restrictions that local municipalities wish to continue to extend certainly would be acceptable, and it's something that he would not take umbrage to. I'm going to, as far as the city of Gary, base all of our decisions as we have, certainly in accordance with the governor's protocol, but also, and equally, or in some instances more importantly, we're going to base our protocol and our directives based on what we feel is best for the residents of our city. Up to this point, we've certainly been following the governor's guidelines, but as mayor, I have the right and the responsibility to be more or less restrictive as we deem necessary. I anticipate ultimately that most or all businesses certainly will be open by the end of May. However, we're certainly relying on the data that we receive on a daily basis and absolutely the recommendations of our health commissioner, Dr. Roland Walker, who by all means is in attendance today. I omitted to recognize him. Thank you for being here, Dr. Walker. Very shortly thereafter, after today there is, my team will present a very concise and specific plan in terms of how we as a city will reopen that covers employees and the public's access to all of our public facilities. But in that protocol will also be specific direction for residents and businesses alike. Spread of the COVID-19 virus, as we all know, remains a very vital threat. Gary continues to see residents certainly testing positive, as well as unfortunately some of them have succumbed to the virus. We also continue to see cases of positive cases, that is, increase in the double digits. And to that extent, it certainly warrants that we must continue to be prudent. We certainly must continue to encourage persons to practice social distancing. And by all means, we're going to continue to follow the governor's protocol. Very shortly, you'll hear from Dr. Walker with the latest statistics relative to positive cases or cases throughout the state of Indiana, Lake County, and specifically to Gary. After Dr. Walker, Dr. McNulty will make a presentation on behalf of the Gary Community School Corporation, and our last presentation will be from Mr. Julian Marsh of the Gary Housing Authority. He'll share information relative to the Housing Authority and our senior population. Dr. Walker.
Thank you, Mayor. First, let me get rid of this mask. I'm sure by now everybody's getting tired of wearing masks, but I think that those masks are really helping, so we want to continue using those to block the transmission of this virus. I also want to say thank you to the citizens of Gary. You don't have to welcome me into your home to watch these updates, to get information. Hopefully we're providing helpful and accurate information that will help us to prevent the spread of this disease and at least maintain some type of plateau so that we can not have big spikes and overwhelm our hospital systems. And also, I want to make sure I say again how appreciative I have been to our mayor, our newly elected mayor, who came into a pandemic situation in the first 60 days of his administration, and he's been very supportive in making sure that we make good healthcare decisions based on science. So thank you to you, Mayor. I want to start off by sharing today's state numbers with you. So far, we have tested 99,639 people in the state, so almost 100,000 people in the state of Indiana. To this point, there have been 18,630 positive cases, and unfortunately, we've had 1,062 deaths. In Lake County, we've tested 8,751 people. Of that, we've seen 1,929 positive cases, and unfortunately, once again, 92 deaths. And in the city of Gary, we're now up to 417 positive cases. That means that I'm sure that this has touched everybody in the city of Gary. Everybody knows somebody or knows a family member who has tested positive at this point. And unfortunately, we've seen 15 deaths. And keep in mind, that number could go up as well from this date, because what our state health commissioner have done, and I commend Dr. Box for this, she has now started including presumptive deaths to COVID in deaths for the state of Indiana, and now we have to go back and look at deaths from the beginning of March and figure out, do we need to increase those numbers from the dates from March 1 going forward. I want to talk a little bit about, Porter County. Let me make sure that I include Porter County in this too, because that's our neighboring county, and we share healthcare systems. And Porter County has tested 1,773 people. Of that, they've had 240 positive cases and 7 deaths. And the reason why we include Porter County, obviously, those are our neighbors directly due east, and we share healthcare systems. They use a lot of our resources, we use their resources. So I think that's something that we need to track and make sure that we are working together. Currently in the city of Gary, everybody asks me what type of testing is going on at the health department. We continue to do testing in the morning from 9 to 12, 9 a.m. to noon, and that is by appointment. Also, Methodist Hospital has increased their testing to include weekends now. And I think that's significantly important because as you've heard me say before, when we get to the beginning of the week, we see a dip in numbers, and then we see an increase in numbers again at the end of the week. And I think that's directly related to not having testing sources on the weekends. So now we can more accurately, as we get the word out there's testing at Methodist Hospital, we can get the word out. We can look at those numbers more accurately to determine whether we're starting to show any type of plateau or decrease. Also, the state of Indiana has let me know that we are going to have some more state of Indiana testing sites in Gary. We're potentially looking at sites like St. Timothy again because of just its location and the size of the parking lot, and perhaps some other locations closer to downtown Gary as well. I did want to speak to you a little bit about a couple of topics. One is contact tracing. Our team, the mayor, people at the health department, our statistician, Mr. Brown, we discussed looking at some enhanced contact tracing. We're looking at some models that New York was using, actually. Why reinvent the wheel when somebody else is doing something? They partnered with Mayor Bloomberg, and so we're looking at using some of those models, perhaps contacting Mayor Bloomberg and see if we can use the programs that they're using and move forward so we can have more enhanced contact tracing. So as we start to reduce some of the restrictions, we're going to really need to follow our positive cases, know where people go, and perhaps be able to mitigate some of the spread of this virus going forward. I also want to share something personal. On yesterday, I was tested for antibodies because it's going to be assumed that I have antibodies to the COVID virus because I was positive over a month ago, asymptomatic positive. And the next step after that, I have signed up to donate antibodies. There are people, I actually was contacted by somebody right before I came here who possibly could benefit from antibodies like myself. So I mention that because if you know that you were positive, there's a website that you can look at going, and hopefully I wrote it down properly. That is, yes, it is, and I'll make sure I provide that to our team later so they can post this. But it's versiti.org/COVID-19 plasma. I'll repeat that, VERSITI.org/ www.bbc.org/COVID-19 plasma. At that website, you can sign up to donate your antibodies, and so it's simply just getting blood drawn, right? Just like if you were donating plasma at the plasma bank. And what they would do that, they will use that, particularly patients in the ICU. We've seen success in treating patients with plasma. This is an old technology. It's not widespread use because people don't usually donate. We don't donate organs, we don't donate blood. So I'm asking us to rethink that and now look at donating, because you could help somebody you know or somebody you don't know that's still alive, and we can increase their expectancy. And we're also seeing a lot of promising studies now in the IV drug remdesivir. Now, you probably heard about this, but these studies are showing promising results. So we're really excited about that. As far as the state and the city lifting restrictions, we'll be looking closely at what the governor says this afternoon, and then our team will get together, and then we will make recommendations specific to our city so that we can get back to doing some of the things. I anticipate that some things will be lifted, and there'll still be some other restrictions going forward so that we can mitigate some of the spread of this virus. So I look forward to seeing those recommendations and working with the mayor to make recommendations for our citizens. And I thank you very much for your time. Thank you.
Good afternoon, everybody. I wanted to take a few minutes. First of all, I want to say I hope this message finds you safe and well at home. But I wanted to take a few minutes to update you on some important things that have been passed on to the superintendents through the Department of Education. And one of them being that we have been told that the government is going to be sending out EBT cards to all of the citizens here who have students who are on free and reduced lunches, which equates to about $300 per student within your household. But they're asking us to provide to them addresses so they can mail those cards directly to your homes. I need your help in calling our schools so that we can make sure we have accurate addresses in our system so that we can get those back to the State Department so they can get those funds to you immediately. So we're asking, again, for you to reach out to your home school. We do have those phone numbers working live so that the secretaries will receive those calls. If it goes to a voicemail, please leave a message and they will call you back. But we want to make sure that we are getting your accurate addresses in our system so that I can then transfer that information down to the State Department, again, to ensure that you are getting those funds to your families as quickly as possible. And again, it's $300 per student within your household. I do also want to piggyback on what the mayor and what Dr. Walker said as far as the stay-at-home order. The schools, however, are still under a governor's executive order to be closed until June 30th. Now, if that should change, I will certainly let you know. But at this point, we are still closed until June 30th for all in-house schooling and sports. So nobody can be in the schools for any kind of training or athletic events or any kind of in-house schooling. We again are going to offer summer school, so I'm reminding parents and students to please sign up for summer school. We've had a tremendous response for students signing up thus far. We have over 1,000 kids signed up for our elementary programs. We did start the 8th grade cohort this summer as well, so 8th grade students can sign up for CTE, which is our vocational program, early this summer to start getting some of those graduation pathways started. So again, I'm encouraging you to get online and sign up for our summer school programs, which start June 8th. Lastly, please remember our food delivery is also every Monday via the bus routes that are listed on our website, so please continue to check our website for updated events. And lastly, I want to give an early shout out to our teachers, as next week is Teacher Appreciation Week. And we're sorry that we're not going to be there to celebrate it with you in person, but we want to make sure that we say a huge thank you to all of our teachers who have done a tremendous job in helping assist our students through this e-learning opportunity. So teachers, thank you. Parents, kids, please send out an email or some sort of a shout out to your teachers. They've done a fabulous job. Thank you, everybody, and stay safe.
Yes, these masks can be a problem, but they do save lives, so let's all keep wearing them. First, good morning. Good morning to the residents and staff of the Gary Housing Authority. Good morning to the residents of Gary, Indiana. Got a few things that I want to report, and I first want to say that I am very happy that at Gary Housing Authority we are not aware of any residents who have tested positive to this virus. I'm saying we're very happy about that because we have 4 senior high-rises. We're responsible for each one of these individuals. One of our goals is to get through this crisis and have no residents that have tested positive. We are blessed to be where we are right now. We are hoping that this will go forward. I'm sad to say that we do have one staff member who has tested positive, but that staff member is on the mend right now, and he has actually been released, I think. We do have a couple of staff members that are self-quarantining. They have been tested. We're waiting to get that test back. But what we're all doing, the entire staff of Gary Housing Authority, is working to do everything we can to make our residents safe. And this is very important. It's very important because, and I'm going to talk about the high-rises right now, one of the things that we are really concerned about is having a case at a high-rise, because these are closed environments, and if one person gets it, we can assume that it's going to spread. We do not want that to happen. I have staff that are going in each day. They are wiping down surfaces every 2 hours to make sure that we keep the potential bacteria down and keep the residents safe. We're doing this with handrails, doorknobs, elevator buttons. So we want our residents to be safe, and we are requiring that they wear face masks when they're walking around the building. I'm happy to say that I have been to many of our sites, and the residents are maintaining this protocol. I think they're taking this very seriously. Everyone knows how serious this is. So thank you to you residents. Keep doing what you're doing. I want you to be safe. But I also want to mention some of the things that are being done at the federal level. One of the things that's happening is HUD is, as many of you know, making funds available to housing authorities that we can spend on our residents to keep them safe. As we keep our residents safe, we're also keeping the community safe. So we are getting weekly updates. I got something earlier this week that we think is going to be that's positive news for our residents, and I'm going to be talking to some of the members of the community and the health department to see what we can do to assure the safety of our residents and the community, of course. And there is another conference call tomorrow. I'll be listening to that to see if there are any other waivers that are being given, allowing us to do more to help keep this virus in check. So I'm thanking the folks at the city for everything you've done, the health department, mayor, you're doing a wonderful job. At the state level, I think the things that are being done there are appropriate. At the federal level, they're still trying to help us, and we appreciate that. So we think things are going in the right direction. We don't think we've peaked yet, but we have to be abreast, stay on top of it. I'm personally working very close with the health department, listening to what they're saying, and we hope that we can get this thing behind us as quickly as possible. Thank you.
So I'd again like to thank Dr. Paige McNulty, Dr. Walker, and Julian Marsh. Before I close, I have a correction, one reiteration, a couple of points, and then we'll certainly close and go on with the rest of the day and the weekend. So the correction is that as brilliant and as intelligent as Mr. Marsh is, I incorrectly stated his position earlier. It's Mr. Julian Marsh. I believe I misspoke and said Dr. Julian Marsh, but he's certainly intelligent and just a wonderful addition to the city of Gary. But wanted to make that point. The reiteration that I want to make is that if Governor Holcomb releases restrictions on our state, and it's not consistent or at least aligned with what happens in Illinois, we can absolutely expect an influx of residents to traverse to Indiana. In that regard, it's extremely important to note that as a municipality, we certainly have the authority and the responsibility to continue some of our restrictions in an effort to keep our residents safe. The couple of points that I wanted to mention that I didn't in the beginning of the presentation is that through Dr. Walker and some of our healthcare providers and other entities, we're now partnering to discover opportunities to provide face masks to as many residents as we possibly can, and we're certainly starting with our most vulnerable populations. We expect that as early as next week we could start to make specific announcements about the availability of those. And the last is a little bit of good news. It goes certainly along with what Dr. McNulty shared in terms of meals being provided. The city has been able to recently partner with a food processing or packing company out of Evansville, Ameriqual, and very shortly we'll be able to provide on a weekly basis for a period of about 4 weeks meals to just about every resident in the city of Gary who desires it, and that'll be a breakfast as well as a lunch meal. So we're certainly looking forward to that opportunity to continue to provide additional benefits to our residents. In closing, as the economy opens, we certainly will face continued or increased exposure to the COVID virus. I want to reiterate the city will do everything within our ability to keep our residents not only informed, but to keep them safe. And in doing so, we have to encourage or at least demand in some instances the adherence to protocol that we know has been proven to help keep people safe, and that is social distancing and limiting gatherings to 10 people or less. As mayor, I'm going to certainly continue to defer to the expertise of our medical professional, Dr. Walker, as well as the entire medical community in terms of the directives that we set. As it relates to the city, our team, as I expressed earlier, is working on setting protocol and processes in which the city can begin to gradually open back to the public. But until then, we certainly want to remind everyone to remain as calm as you possibly can. Certainly, we thank you for your patience, and please remember that we can all and we will get through this together. Thank you.